HealthBreak is sponsored by
Providence Health and Services, serving Montana.
Before any surgery at Providence St. Patrick Hospital or Providence St. Joseph Medical Center in Polson, the patient is tested for COVID-19. Chief Physician Executive Dr. James McKay explains the many reasons why.
We do that a few days ahead of the procedure, and the reason we do that is really threefold. Number one is to protect the patient, because early in the pandemic, studies demonstrated that patients who had COVID, whether or not they were symptomatic, had poor outcomes when they had procedures done. The number two reason we do it is to protect our own caregivers, because we want to minimize the possibility of our caregivers coming in contact with people who are positive for COVID. And the number three is really by protecting our caregivers, we're protecting the entire community, because we need our caregivers to be here in the hospital to give their care and expertise to take care of patients. Early in the pandemic, back in March and April, a lot of people weren't coming into the hospital for care when they really needed it. There were people who had heart attacks and strokes and other serious issues, and they put off care because of concerns about COVID and had worse outcomes. And so what we want to do is make sure people are reassured that it's safe for them to come to the hospital and get the care they need, because we're not just caring for COVID patients, we're caring for everyone else as well.
To find out more, visit montana.providence.org.
HealthBreak was sponsored by
Providence Health and Services, serving Montana.